Welcome to the Motivational Midwife. My name's Lynn Jones, and today we're going to be looking at recognising the deteriorating client. So let's look at the deteriorating client and how we can recognise it. So really, when you are thinking about deterioration, definitions are varied depending on where you're looking, but the key point to take away is that actually a deteriorating patient is a dying patient. If someone's condition is going downhill, the end of that hill is death if we don't actually step in. So one of the definitions that I found that I actually thought was quite useful was this one, where it says that it's defined as an evolving, so it is developing, predictable, we can see where it's heading, and symptomatic process of worsening physiology. So your signs and symptoms are there that are showing you that it is heading towards critical illness. So who's at risk? Well, actually, any of us are at risk. Anybody is at risk, but there are certain groups that are more at risk than others. So anyone who's got underlying medical conditions. I mean, most of our population that we deal with are fit, healthy women and birthing people. So we don't usually have too much problems with them. But actually we intervene, and we do a lot of interventions that are putting them more at risk of deterioration. So post-operatively, so caesarean sections, manual removal of placenta, forceps, Montus, anyone that's been, had suturing done, anyone who's had postpartum or antepartum hemorrhages, any sepsis, all of these people are at risk of having a deteriorating condition. And to be fair, even just post-birth, anyone's condition can deteriorate quite quickly, depending on what the circumstances are. So there are a number of things that we can have that can help us recognise that deteriorating patient, and kind of top of that list is the Myles chart, which we'll go into in a little bit more detail. But a holistic approach and observation is going to really aid you. So do that A to E, top to bottom holistic approach when you are looking after somebody. Be observant as to how they are generally. Do they seem a little bit less alert than they were? Do they seem in an excessive amount of pain for what they have been through? And I will just tell you briefly about somebody I had. Now, we don't see a lot these days of something called paralytic ileus, which used to be quite common after any sort of abdominal surgery. And back in the day, and back in my day, you would listen for bowel sounds before you let anyone have anything to drink or eat after surgery, because sometimes the bowel can be handled during abdominal surgery, and it can stop that peristalsis for a period of time. And so I was supporting an international midwife on a postnatal ward, but answered a call bell to a lady who was 2 days post caesarean section and had come round from delivery suite, because she'd been quite poorly after the caesarean section, but more with mental health problems than actual physical problems. But she was in a lot of pain, and I mean a lot of pain. And so that led me to think this is far too much pain for somebody who is 2 days post-section. This isn't normal. Something is not right. And it turned out she did actually have an obstructed bowel. So it's important that you really, and to be fair, there were some comments of it's in her head, and this is why we need to take this holistic approach. Yes, she had mental health problems. However, don't be dismissive of what she's telling you and put everything down to just her anxiety and her mental health. You know, this girl clearly was a young girl, relatively fit. 2 days post-section should not have been in that much discomfort, that much pain, that she literally could not move. So, you know, take that holistic approach. It may well be that there's some psychological aspect to it, but don't be dismissive of it. Make sure you have covered all bases, that you have done that top to toe holistic approach, so that you have excluded anything physiological that may be going on. So our Myles chart. So let's just take a few minutes to run through the Myles chart. And I'm sure you've all seen these, or a variation of these, within the trust that you work in. And they're set out in such a way, I feel, is that they kind of go in order of importance. So right at the top of this chart is respirations. And respirations is probably the one observation that both nurses, midwives, doctors, we are notoriously poor at actually undertaking. But respirations is the first sign that your patient is actually deteriorating. So why do resps go up? Well, resps go up in a deteriorating patient generally as a response to tissue hypoperfusion. So there is a lack of oxygenation to the tissues. And the only way we can get more oxygen in is to breathe quicker. And if we breathe quicker, then our heart rate's going to also increase to try and get the oxygen we are breathing in round to the tissues. But let's go back to those respirations. Now, there are other reasons that respirations go up as well. Pain is one that they will go up. So if you have somebody in labour, they're very anxious, they're in a lot of pain, their respirations may well go up. But this is where, as I say, your holistic approach comes in. Because if you resolve that pain area, her respirations should settle to a normal rate. And if they don't, then it's not the pain that's causing it. So looking at our chart, what is worrying? Okay, so a red score would either be below 10, respirations are below 10. So when might you have respirations that are below 10? If you have somebody that is full of narcotic drugs, any narcotic drugs are a respiratory depressant, so they're going to dampen down that breathing, that respiration rate. And so if they've got very low respiration rates, so less than 10, they could become hypoxic because of that. They're not breathing enough to get enough oxygen in. And very often, you know, we give women pethidine or diamorphine. And how often, when you are doing their observations, do you then check their respiration rate? Not very often, I hazard a guess. Above 20 would give you an amber score. And above 30 would be very concerning. But I'd like to think if you were above 30, you really would recognise that they are very quick. So below that, we've got our saturation. So actually, if we are tissue hypoperfused, you would expect the saturations to actually start declining. And what's worrying? So for most charts, it actually is anything less than 95% in air. We're looking at saturations in air initially. So anything less than 95% would be concerning. However, having said that, some charts actually have less than 90 as a red and 90 to 95 as an amber. If you're struggling to maintain saturations with oxygen supplementation, then that is very concerning. Then looking at temperature. Temperature is not really a particularly good indicator of whether something is going on or not, particularly from a sepsis perspective. But our parameters will give you a temperature of less than 36. 36 or less is going to give you a red, and more than 38 degrees is going to give you a red. And certainly it will trigger a sepsis screening tool in most trusts. And as we've said, our heart rate, which is the next one down, is if we are tissue hypoperfused and our respirations have increased, then there's a very good chance our heart rate has also increased. So what are our parameters that we're worried about? So a heart rate above 100, and actually that's not that uncommon in women who are in labour, who are dehydrated, women who are anxious, frightened, not uncommon to have a heart rate that's, hovering around the 100. But again, holistic picture. You need to look at everything that's going on. So above 100 is going to score you a yellow, and above 120 is going to score you a red. Below 50 is going to score you a yellow, and below 40 is going to score you a red. There are some people who are particularly fit and healthy, perhaps have done a lot of exercise pre-pregnancy, who naturally have a lower heart rate, more towards that 50 end. But again, we're back to that holistic picture of the person you're caring for. So your next thing down on the Myles is your blood pressure, your systolic blood pressure. And blood pressure is actually a very late sign in most instances of a patient deteriorating. And that's because women compensate extraordinarily well. Remember, they've got 50% extra circulating volume in pregnancy, so they can compensate very well from a volume perspective before blood pressure is affected. But what are our parameters? So from a systolic perspective, if we're looking, amber is more than 150, and more than 160 will give you a red. And less than 100, 100 or less, and 90 or less will give you an amber and a red. Now, antenatally, lots of women actually have a blood pressure that the systolic sits around about the 100. 95, 100, and that's normal for them. So again, it comes back to this importance of looking at what is normal for her. Diastolic, we're looking at 90 to 100 will give you a yellow score, and more than 100 will give you a red. Then that brings us down to urine output. So why is urine output important then in our holistic assessment? So if you are tissue hypoperfused, one of the first organs that is going to suffer is the kidneys. So if it is lacking oxygen to the tissues of the kidney, it's going to not be able to produce urine. So we're looking at that urine output. A lot of trusts will just say 25, 30 mils an hour is adequate, but that actually is incorrect. We're talking at that for an average sized person potentially, but what your correct calculation should be is 0.5 mils per kilo per hour. So if you have a woman who is 100 kilos, that's actually 50 mils an hour she should be passing. And equally, if you have somebody who is 50 kilos, that will be 25 mils an hour. So it really does need to be tailored to the person you're looking after, because if you have got somebody that's 100 kilos, and there are a number of our women who do meet that threshold now and above, then if they're only passing 30 mils an hour or 25 mils an hour, that's actually half what they should be passing. So there is obviously some kidney tissue hypoperfusion going on there, or something going on with their kidneys. Proteinuria, certainly 2 pluses or more is going to score you a red. And on most Myles charts, you also have amniotic fluid giving you a red score for meconium. And in most trusts, that red score, of course, with meconium is going to trigger a sepsis screening tool as well. Then you've got your neurological assessment. So how alert, is she alert? Is she responding to voice, pain, or unresponsive? And also, is she confused? Because if we have tissue hypoperfusion, that also means there's a lack of oxygen getting to the brain. So therefore, she may be a bit muddled, a bit confused. So once we've done our holistic A to E approach, and we've looked and we've done our meows assessment and we are concerned, then who are we escalating it to? So in the first instance, that might be the midwife running the area you're working in. But at some point, you're going to want a obstetric review of this lady. So you're going to get a doctor to come and look at her. Now, how quickly that doctor comes is going to be very dependent on the S-bar that you give them. So you need to be very clear about what your concerns are, what the situation is, what the background is. Your assessment is your meows score. What is she triggering? And your recommendation is that you want them to come immediately or within 30 minutes to review this patient. If you are, generally it's the SHO that's going to come and review them in the first instance. And so you bleep the SHO, you say, you know, I've got this lady, I'm a bit concerned about her. Could you come and review her, please? That doesn't really tell the SHO anything about really what's going on. So they are covering more than one area. So very long list of things to do. Yep, I'll add it on the bottom of my list and I'll get to her eventually. So you need to be very clear in your recommendation that you want them to come and review her now or within the first 30 minutes. And you can be guided by that on your meows charts. Very often on the back of the meows chart, it will give you some guidance as to how quickly this person needs to be reviewed, what time scale you're looking at, given the score that they are scoring. So in conclusion, be alert for those people that deteriorate. People can deteriorate exceptionally quickly. Be very observant and do not be complacent about your undertaking respiration rates at any point in the care that you are giving, be it antenatally, intrapartum or postnatally. Use your meows charts correctly and escalate appropriately with an S-bar and document accurately and appropriately. And there you have it. I hope you found that useful. If you haven't subscribed to the channel already, please do so. And also find us on Facebook at The Motivational Midwife. I look forward to seeing you next time.